Hi, this is Jessica DaMassa with WTF Health. I am here with Glen Tullman. He is the CEO of Livongo. Hi, Glen. How you doing?
Great. How are you this morning?
Fantastic. So you're on a massive acquisition spree, right? After closing your $105 million round. No, so tell me a little bit about that round, about this influx of cash and what you guys are going to do with it. You've already acquired Retrofit. Talk to me a little bit about what's going on.
So we were really happy with the round because it was an internal round, and we already had a lot of cash. So when your internal investors come to you and say they want to put more money in at 2.5 times the last valuation, pretty much when they're passing the hors d'oeuvres, you take one. And that's what we did. So we were happy to do that and add one new investor, which was Echo. And that Echo represents Blue Cross Blue Shield plans of Cambia in the Pacific Northwest as well as in North Carolina. So we were happy to add them as well. And that will give us the money that we need to continue to fund the growth that we have and where appropriate acquisitions or building products or partnering.
All right, so talk to me about Retrofit. What do you think they're going to bring in to your solution?
Well, what happens? So think about what we do. So we're empowering people with chronic conditions to live better and healthier lives. And if you do that and all you're doing is diabetes, 70% of our people have hypertension. Okay. And so when they have hypertension, if all you take care of is their diabetes, they still have hypertension. Right. So they say, can you do both? I only want one app to do both. And then those people usually have weight issues, some of them, and what we really want to do is keep them healthy. So pre-diabetes, which was a strength of Retrofit, we acquired that. We acquired weight management. We acquired more expertise in nutrition. That all fits on this experience that we're building about better health.
How many users do you guys have these days?
So we have just under 100,000 users, and we think that's probably one of the largest connected real-time remote patient monitoring applications in the market today. And I think what's most important is how happy they are. So 62 is our net promoter score, which is unheard of in healthcare. And we're making them better. We have clinically proven evidence that shows that, and we're saving money for their employers. So it's working.
Great. So we've been talking, I've been on this conference circuit, and I've been talking to a lot of people about kind of where the future is headed in terms of a lot of the different solutions that we're seeing. And one of the sentiments that's come up over again and again recently this year is that basically like one-off apps are dead, and now everybody's looking for a platform. So talk to me about you guys, because you're kind of one of the original platforms in my mind.
That's right. Well, first of all, I don't like the word platform. Okay. Because I always try to approach it from what are our members thinking about? And they're thinking about what kind of experience do they have? Yeah. And so what they want is they say, just make it go away. I don't want to be more engaged. I want to be empowered. Give me tools that allow me to manage whatever I have to deal with better. Sure. And we want to make that experience incredible. Just like the experience of everything else that you use outside of healthcare, we want to bring that consumer digital health experience into healthcare. And so not so much a platform, but tell us what you need and we'll provide it. We'll serve it up real time. Don't think about technology. Think about the experience you're having. And if it's great, then we win and our member wins and healthcare wins.
Okay, so you walked right into it. You brought up those consumer technology experiences. Mm-hmm. So we've got this influx, coming around again now with those technology companies like Apple, Amazon, Google. They're making a bigger push. Yep. So what are you most looking forward to, I guess, with them coming into the industry? Or are you in one of those situations where you're like, uh-oh, we better watch our backs here?
Well, so look, there's a lot of great companies you mentioned, whether it's Amazon or Microsoft or Lowe's, or these are all partners of ours. So we're working with them. We're helping them, we're learning from each other, and I think you're going to see a lot of that. Cambia, which used to be thought of as a big payer, now they're thought of as a health services provider, solutions provider in healthcare. So everybody's in the process of redefining themselves, and we want to partner with the best, most innovative people to partner, so it doesn't really matter who they are. What I'd also say is, look, there's a lot of people talking about innovation, and you got to be out there and you have to make it happen at scale. Yeah. And that's what people have trouble doing. Right. Fortunately, today, Livongo is dealing with 350 companies, 4 out of the top 7 payers, the top 2 PBMs. So we're pretty excited about the traction we have. And the main reason for that is people love, not like, but they love what we're doing for them, and we're keeping them healthier.
This is you again. You're just like handing me these ways to jump in on these questions. So again, I mean, you've got a reputation for bringing companies and scaling them up very quickly, taking them public, and there's a lot of chatter about Livongo going that direction as well. And we have a lot of startups that watch. So hit me up with some advice here. I mean, these guys all look up to you. I mean, how do you do that? What's your best advice for an entrepreneur who's looking to scale up, number one, and then do they want to go public?
Well, first of all, there's a few things. One, you can want to go public, but you can't go public. That's a determination from where the company is, where the market is.
Yeah.
So all you want to do is be ready to go public and have the optionality to say, we can go public, we can raise money. The way you do that is, first and foremost, build a great company.
Do you start that way? You know how some people say you build for your exit?
Never.
Okay.
So I've learned, because I've been at some companies more than 10 years, and I would have thought maybe I'll spend 2 years there or 3 years there. So do something you love to do something that's making a difference, and don't ever talk about anybody who ever comes for an investment from Seven Wire Ventures, our venture firm, and says, I'm going to exit this way or that way. We don't invest. Because basically we want them to build a great business first, and then worry everything else will happen. And you should never want to. Why do you want to get out of the business? There's a lot of ways to monetize the business today. You don't have to go public. And as I was saying recently, we talked about it before, that some people say the best day of going public is the day you go public, because that's a wonderful day. But after that, you've got a whole new set of people you have to manage for. And what we want to do, first and foremost, is really solve important problems in healthcare. And by doing that, we'll create lots of value. And whether that's public, whether it's private, we've got great investors. This last round was led by General Catalyst and Kinnevik, which is a great Swedish investment firm, but just a slew of really incredible investors. And so they're patient, they're willing to invest more, as they showed in this round, and then we'll make the right decisions. But I think it's safe to assume that it's an option on the table. I wouldn't say it's not. I think it's safe to assume that we're going to expand this experience. So we like the behavioral area a lot, because that's something that everybody's dealing with. And to stay healthy, we all have to be happy. Yeah. We have to have half of your energy at least, maybe more. And that's what people are looking for. So give us solutions that allow us to do that. And that's what we're doing at Livongo.
All right. Last thing for you, we always ask everybody, WTF Health. So what's the future, Glenn? What's the future in this space?
Is that what it means?
That's exactly what it means. What did you think it meant?
So look, I think we're at a very unique time. And, you can have a great product and have it at the wrong time. This is the right time. So why is it the right time? Well, one, we've run out of money. So everybody is saying, I'll try almost anything, because we can't do what we did. And if you look at the announcement that Amazon, JP Morgan, and Berkshire Hathaway made, that announcement, they don't have the business structured. What they really said is, we are so dissatisfied with what's happening that we're going to have to do it ourselves. And I think that's indicative of the market saying, we're going to try all kinds of solutions, but they're also saying, listen, we wanted innovation. You've given us so much innovation. Give us a way to manage it. I also think that the market and innovation is going to be driven by self-insured employers. Okay. So that's really exciting, because they make decisions quickly. Yes. They are the payer. There's no intermediary, and it's got to work. And so there's only 3 metrics. Do our people love it? Do you make them better? Can you measure that? And lastly, do you save money? And if you do, you're going to be successful. And if you don't, you're just going to be small and maybe well-meaning, but you're not going to be successful in the same way. And again, Livongo and our team has been able to demonstrate consistently that we hit on all those 3 metrics, which is why we're growing at the rate we're growing.
Awesome. Well, Glenn, thank you so much for your time. It's a pleasure to speak with you. Thanks so much. This is Jessica DaMassa with WTF Health.